Hi everyone, welcome to my YouTube channel. Today's topic is how to write answers in theory question paper in the MBBS curriculum. As we know, within 2 days the theory exams will going to start. So we will discuss how to write the answers in main exam. First, what is the difference between RS3 and RS4 pattern? First, in the RS3 question paper, there are 2 10-mark questions and 10 5-mark questions and 10 3-mark questions. In RS4, there are 10 MCQs, 2 10 markers, 8 5 markers and 10 3 markers. There is no difference in the syllabus among these 2 patterns. So syllabus is same. For getting more marks in theory paper, it's not about reading and preparing for a theory exam. It's about how you are writing your answers in your answer booklets. It's more important than reading and preparation. So we'll discuss how to write more effectively to get the highest marks. First, whenever you are getting the answer booklets in the examination hall, you should write basic data, means your name, roll number and answer booklet number. Whenever you are writing your roll number or attempting the questions, you have to fill those circles. So make sure don't do silly mistakes in this process. Whenever you are getting the question paper, don't look at every question at a time, because if you are not knowing the one question, you are ruining your day. So trick is to go with the flow. If you are starting with the 5 markers, start the first question and attempt it. If you are not knowing the answer, shift to the next 5 marker, leave the first one. Whenever time comes, if you are remembering that answer, you can write. Attempt in the serial sequence of question paper. Don't do first you are attempting 3rd question, next 7th question, next 11th question, next again directly 22nd question. Attempt in a sequence wise, so it will create a positive impact in the evaluator's mind. During writing the theory answer booklet, time management is the main key. So my approach for this theory exam is first attempt 5 markers, take 1.5 hours, and next will be 3 markers around 30 minutes, and attempt 10 markers at the end simultaneously around 12 minutes each, and in the last 15 minutes you can attempt those 10 MCQs, and in the last 15 minutes you should recheck all the answers of all the questions. If you are missing anything, you should write it in that 15 minutes. For 5 marks questions, in the first half of the page you can draw one diagram. In next half of the page you can describe that diagram and write the relevant aspect of that question in the next half of the page. In the second page, you should write some clinical features or signs and symptoms, investigation part or treatment part, or if you are remembering any flowchart for that question, write it and explain it. In next half of that second page, you must write a clinical aspect for that question. Not only for 5 markers, writing the clinical aspect in the 5 marker, 3 marker and 10 marker will get you more number of marks in the main exam. While attempting 3 markers, don't do bluffing. Straight answers are required in these 3 markers. Write straight answers and draw any diagram or any flowchart. And last, you should write a clinical aspect. Don't extend into 2 or 3 pages, because time is limited in 3 markers. At last, attempting 10 markers, don't do this mistake. Don't start with 10 markers. If you are writing 10 pages also, you are only getting 6 to 7 markers. So write only 4 to 5 pages for each 10 markers. And trick is start 10 markers simultaneously. Means first and second questions are 10 markers. Write 1 page for first 10 marker and again complete the first page for second 10 marker, and start with the second page of first 10 marker and again go for second page for second 10 marker. If you are doing like this, you are approaching the both questions in a similar timing, so you are getting more number of marks. At last, don't leave any questions, because thumb rule of the question paper is if you are completing the 50 pages, you are most probably getting 50 marks. A day before exam, stay calm, stay cool. You can't change the dynamics of next day. So minimum 10 hours of revision, a nice sleep and a nice meal, and don't do night outs. Don't have coffee before your sleep. And on examination day, before in the last 1.5 to 2 hours, don't read anything, and don't talk with your friends about the exam. Talk with your parents and have a positive mindset, have a smile on your face. Go to the examination hall before 30 minutes and write the answers as I mentioned in the first part of the video. And bonus point is, in the question paper, if you have a lot of bouncers, don't become blank, because everyone has that bouncers. Don't give the answer booklet to evaluator, and don't run away from the examination hall. Sit there, have a 2 to 3 deep breaths, and write the relevant answer for those questions. You are getting your marks in those questions. And if your exam is not going well as you are expecting, don't ruin the next day's exam in the dilemma of that. So it's just a theory paper, so write it and rock it. All the best.